Hello, everyone, and welcome. And thank you for tuning in to Health Leaders, the place for peer-sourced and solution-focused insights for healthcare executives. My name is G. Hatfield, and I'm the CNO editor for Health Leaders. Today, we are speaking with Cheryl Reinking, who is the Chief Nursing Officer at Camino Health, about strategies for lowering turnover rates. So, hi, Cheryl. How are you?
Hi, I'm doing great. Thank you for having me.
Of course, it's great to meet you. Thank you for taking the time. So let's jump right in. Obviously, one of the key factors right now for CNOs in healthcare is nurse turnover rates. We're experiencing workforce shortages, as everybody knows, I'm sure. And one of the things that could, help address that would be lowering turnover rates. So, what are some of the key factors that you see contributing to nurse turnover in the first place?
Well, of course, since the pandemic, you just can't talk about turnover without bringing in the pandemic. Even though it started
Mhm.
5 years ago this week, it was declared a pandemic. We're still
Wow,
feeling the
yeah,
effects of
yeah.
the pandemic in nursing.
Mhm,
And so going through the challenges as it relates to the pandemic caused tremendous burnout
mhm,
of our nurses, and particularly because they were often the sole caregivers of patients who were going through tremendous challenges with COVID and other illnesses, and
mhm,
were tremendously overburdened,
mhm,
both emotionally and physically during that time. And so we've coming out of that. We're still challenged with continuing to address the needs of the workforce as it pertains to burnout. The other thing we've seen is workplace violence has
mhm,
gone up dramatically, even since the pandemic. I mean, it was
mhm,
there before, but it seems to have also increased.
mhm,
And of course, nurses having more flexibility and in their work schedule and balancing their work life integration.
mhm,
It's the
mhm,
new term for work life balance,
mhm.
which I think is a great new term because I'm not sure there's ever any balance.
Yes, yeah,
But
yeah.
you learn to integrate those things.
Mhm,
And then, of course, trying to take away the burden that is added on to nurses, but
mhm,
also making sure that we're recognizing nurses for their immense contributions to patient
mhm,
care and to the health of our communities and our populations. They're right there at the front line, and we need to continue to recognize that um, every day.
mhm. Absolutely. And I can't believe it's been 5 years already since the pandemic. That's crazy
Yeah,
to think about.
yeah,
Oh my
yeah.
goodness. It feels like the world was never the same.
No, that's
Yeah,
right.
it's crazy.
Hmm.
So, speaking of COVID-19, I heard through the grapevine that you were able to return El Camino Health's turnover rate to its pre-COVID rate of 5%. So, can you walk me through a little bit about how you did that?
Yes, absolutely. So pre-COVID,
Hmm.
we had uh, enjoyed a less
Hmm.
than 5% turnover rate. And one
Hmm.
thing I want to be sure that I also mention is that El Camino Health is a magnet organization.
Hmm.
And so magnet organizations are often known for low turnover and low vacancy, which we have been for 20 years and have
Hmm.
enjoyed that low turnover rate.
Hmm.
Now, during the pandemic, due to the things I just talked about, we saw our turnover rate go up to 12.7%. That's
Hmm.
the highest it's ever been. And I've been here for 37 years.
Hmm.
Um, and I've never seen it that high. And so that was tremendously concerning. Now, that's lower, in fact, less than half of what
Hmm.
the national rate was at the
Hmm.
time. However, for us, that was tremendous. We're a small, relatively small, medium sized organization. And
Hmm.
so we really wanted to understand what it was that was contributing to that turnover rate. And there
Hmm.
were many, many factors. It's not just one factor that was causing the turnover. And so we had to look through the many factors that were causing that turnover. One of those things was making sure our nurses were engaged and being recognized. So making sure we have recognition programs in place
Hmm.
to address those many, many uh, important activities and care practices that nurses bring to the patient care and to the bedside.
Mhm.
And then, of course, trying to help to prevent workplace violence episodes.
Mhm.
And then also, we brought in a nurse retention specialist
Oh,
because what we
interesting.
found is that nurses want a trajectory of advancement.
Mhm.
And if they don't have that trajectory, especially the Gen Zs who are now in
Mhm.
our workforce, they want to
Mhm.
know what's next.
Mhm.
And so we want to make sure we create a plan for them to know what's next in their career trajectory while staying at El Camino Health. So this nurse retention specialist that we hired back in 2024 is creating plans for
Mhm.
our nurses to know, if I want to be a critical care nurse or a labor and delivery nurse, how do I get there in 3 to 5 years? What's my plan?
Mhm.
And that's also been tremendously helpful to us as well.
Yeah.
Mhm.
Yeah, that's fantastic. I can confirm as a Gen Zer myself. We do have that
Yeah.
mindset. So
Yes, I'm raising two of them.
Mhm.
So
Mhm.
I do
Absolutely.
understand.
For
Yeah.
sure.
Mhm.
Yeah, so you mentioned it a little bit already with things like recognition, but what are some ways that CNOs can improve an organization's culture and work environment to get nurses to want to stay? Because obviously that's a pretty big factor.
It is. And I think that culture of recognition at the front line is really key. You
Hmm.
know, we've implemented a tool here called Laudio. It's a
Hmm.
software tool that our managers use.
Hmm.
And we could do a whole nother session on manager burnout
Yeah. Hmm.
because
Hmm.
it's a really tremendous problem
For sure.
in healthcare. But we'll talk about nurses at the front line right now, because what Laudio has allowed us to do, the software, is to have managers be able to have information coming to them from disparate systems, from
Hmm.
our human resources information system, as well as our time and attendance system, and serving it up in one platform to the manager so that the manager can then simply, through just one or two clicks,
Hmm.
recognize an individual for their birthday or for
Mm.
their work anniversary or
Hmm.
for working an extra shift.
Hmm.
And that's been tremendously well accepted, and really has been seen as boosting our engagement of
Hmm.
our nurses, as well as making sure we do those 60, 90, 120-day check-ins. And
Hmm.
though that reminds the manager, hey, new nurse, I want to be able to meet with you and talk to you about how your first 30 days have been. What do you
Hmm.
need to be able to feel like you're integrating into the El Camino culture? And how can I help you continue to do that? Those are key best practices. We want to make sure they happen every time. And so Laudio helps the managers remember to do that and
Hmm.
connect with the staff and help put those meetings together. Those are just a couple examples of what the
Hmm.
software has been able to do
Hmm.
to help ensure that our nurses are engaged and want to stay.
Hmm. Absolutely. So, are there any programs or incentives that you would recommend to other CNOs that can help implement, or that can improve retention in general? Not even necessarily like decreasing turnover rates, but
Yeah.
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 What are your
Well,
thoughts?
of course, I think that as much um, there's never too much recognition. There's
Hmm.
never.
Hmm.
So, any way that you can build recognition and engagement platforms, whether that be
Hmm.
software or other recognition programs that are out there for nurses like Daisy,
Hmm.
those are all really significant and important to recognize our frontline nurses. I think the other thing we've done here at El Camino, like I said, is build in those career pathways for our
Hmm.
nurses and
Hmm.
making sure we have transition programs in place so that if nurses want to go from med surg to critical care, there's a pathway for that. And we're
Hmm.
supporting them to get through their career trajectory and journey,
Hmm.
feeling really very supported. And then finally, the other thing would be that we want to address any burnout issues that may be emerging. We also did hear something interesting where we were able to hire an employee support specialist who's
Oh,
right here
cool.
on site. She's actually a licensed clinical social worker, but has um, trained in really mental health support. And so sometimes things really happen to nurses that are traumatic. And, patients may have died on your shift, or you may have lost an infant, or may have made a mistake and feeling just very upset, depressed. And if you go home after your shift with those feelings, they stay with you for a long time. So this employee support specialist can meet in the moment with our clinical staff and help to be that decompression that they need, that person they need to talk to about what just happened during their shift. That's been tremendously helpful. And then another thing we've done is to put in what's called the calm team, so that we can address patients who seem to be escalating in their behavior, bring in mental health professionals in a proactive way to ensure the patients who usually the reason they're becoming aggressive is they have an unmet need. So we can help make sure that we're providing that unmet need through that mental health support at the bedside. So it's not just one thing. I wish there was a magic bullet, but we've been trying to understand all the different things and what's made the biggest difference. And I tell you, it's not just one. It's all of these things to address the nurses who are working so hard, taking care of our patients and our communities.
Absolutely. Yeah. I love the idea of a calm team. I feel like I need one of those for me. Absolutely. So then, with all these things in mind, what metrics are you using to keep track of what is impacting nurse turnover?
Yeah. Well, of course, our workplace violence incidences, we're tracking those to ensure that we're seeing those go down. We're also looking at our number of transition programs to ensure nurses have a path forward and how many have progressed and do they stay. And so we're tracking the turnover on that, as well as, of course, our overall turnover. We're also looking at our exit interviews. For those people who did decide to stay or decide to leave, why did they decide to leave? And so looking at the reasons for leaving. Those are some general things. And then, of course, the software program that we use, we look at how engaged our managers are with those nudges they get from our software platform called Laudio to interact with our direct care staff and ensuring that interaction goes on, because we know those managers who engage 75% or more have lower turnover and higher engagement.
Absolutely. And you mentioned exit interviews. When nurses do leave, how are you applying that feedback and that data that you're getting towards your retention strategy?
Yes, so that is important. And so our nurse retention specialist is gathering that data. And then a lot of it have to do, what we've learned is that nurses don't see where am I going next and their promotional ability. So that's really an important need. And so when we are hearing that that's happening, we want to make sure that our nurse retention specialist is out there and addressing the nurses who may be thinking, I want to do something else. I'm just not sure what that is. And what she's done recently is created a shadow program so that, I think I might want to be a labor and delivery nurse, but I'm just not quite sure if that's what I want to do. So maybe you should have the opportunity to spend a shift with a labor and delivery nurse to see if that's what you want. So we've created this program recently based on that feedback so that nurses have the ability to look at other specialties more deeply than just thinking it would be a great place to be.
Absolutely. Well, it sounds like El Camino Health is doing a lot of great work. And thank you so much for your time, Cheryl. I'm really grateful to have had this opportunity to hear your insights. And thank you so much to our audience for listening.
Okay, thank you very much for having me. It's a pleasure.